All right, good evening, everyone, and welcome to the live NREMT review session. It's April 30th. My name is Dan Limmer, and we're going to get started now. We have a lot of people signed up here, and they're coming into the room as we speak. Limmer Education is a company that's really all about helping you pass the National Registry, and I'm very glad that you came by today. Now, we're going to go over a few ground rules before we start. And first, we will send you a recording of this. You'll get that in an email tomorrow. In your GoToWebinar control panel that you see on your screen, there's a place that says questions. And pop that out, and any questions you have for us, send those along as we go, and we'll try and answer some of those questions live during the webinar, as well as being able to send out some answers to some of the more popular questions afterwards. Also in the GoToWebinar control panel, you'll see some handouts. In there we have our 4 steps for evaluating NREMT questions. We're going to go over that as part of this webinar, and also some information on products and a discount code for those products. So that is the plan for today, and I think we should go. I think I can start by introducing myself. My name is Dan Limmer, one of the founders of Limmer Education and Chief Knowledge Officer. I've the good fortune to be in public safety for really for now, I guess, more than 40 years. And as a paramedic, a police officer, educator, I'm happy to speak at conferences quite a bit. And I've written several EMS textbooks. If your EMT book, if you're here for EMT and your EMT textbook is yellow, I know you don't always know the title of the authors, that would be the book. And it is my job here today to help you with the National Registry. Limmer Education has actually been doing this for about 10 years. I'd like to think we get better every year at doing that. So we're going to get into that right now. Now, a philosophy that we've developed over time is that there are 3 things that I personally believe that you need to know or to do or to have to pass the National Registry. The first of those things is knowledge. The National Registry will give you questions that will start a little below the expected competency level of an EMT, and they will gradually get more challenging. It's important that you know your course material. And by the way, this session would be good whether you're here to prepare for EMT, AEMT, paramedic, EMR, whatever you're doing, this session will apply to you. And you need to know the knowledge that is part of the education standards that cover your course. Now, the second thing, and I think something that gets people quite frequently, is seeing National Registry style questions. And these just seem like they're written a little bit more, a little differently than the ones you're used to in class. And quite frankly, it can mess with your head when you sit down there. You walk into those test centers, which I hope will be open soon. Some have been, others, will be as we go. And you get in there, and all of a sudden, you've got this pressure on you, and then these questions come up on the screen. And if you've seen the memes and stuff out there, and Facebook groups, wherever you happen to be, where it's like they're written in another language. And we're going to talk about how the questions are written today and help you prepare for those. You need to be able to understand them before you go in. That's not the time to figure it out. And the last thing I think you need is, I think you need some mojo. You need to believe that you can pass the test. Now, at the EMT level, the most popular level tested, about 70%, and it ranges year by year from 68 to 70 or 71% that pass the first time they go to the test center. And that's good. And quite frankly, a certification test for something important, as important as EMT or AEMT or paramedic, shouldn't be easy. But that does mean there will be people that don't pass, and don't ever give up. I want you to go back, and I want you to succeed, but it does knock down your mojo a little bit. I mean, it really does. So we've got to get you to the point where you believe that you can go in and pass the exam. I mean, it is just that important. And the way you study is very important as well. So we have we have exam prep products, our EMT and AEMT and paramedic review, our EMT, AEMT and paramedic pass. I'll talk about the pass apps in a second here. But when you use these, right, now what people like to do is have test questions and practice. You get through with the class and you want to practice. So you go through and you take a test question, you see if you got it right or wrong, and boom, you move on to the next one. I'd like to give you a little bit of a different plan, especially when you're using really good questions like we give you here at Limmer Education. So the first thing I want to do, this is probably not a bulletin to anyone, is to read the question. Okay, it's very important that you read the question. Choose an answer. All right, that's good. But if you get it wrong, look back at the question and figure out what it is that you missed that would have helped you get the question right. Right? With questions that are written like the National Registry gives you 4 choices. And in those 4 choices, everything is a little bit choosable. Right? And they're going to ask you for a conclusion or a decision or something serious, not just to remember what bone is in the upper arm, or, they're going to give you a question you're going to have to think about. So read it, pick an answer, and while you're getting ready and you're preparing for the test, get the answer, and maybe there's a rationale, read the rationale, and then go up to the question and say, what did I miss in this question that would have helped me get the answer right? That's how you need to be able to do this. And the last thing is that, keep a pad by you. Maybe it's a tablet, a pad. But every time you see something you don't know, write it down so you can look it up. Right? That way you're studying smart. Listen, I write an EMT book. I want you to love my book. But if you read the book, did your homework, and paid attention in class, the number of people that tell me, oh, I read the book a couple of times, or I went through the book a couple of times to prepare, if you've already done that, get some good test questions and let that determine what you need to study. If you say, okay, I'm bombing out on OB questions, well, then go back to the book and go to OB. But, study smart. It's a really important thing that I want you to do. Now, I told you about some of the apps we have. I just want to talk a second about these pass apps. We have these pass apps for EMT, AEMT, and paramedic. You can see these icons. Our apps are available on the Apple and the Google Play stores, as well as at our site at lc-ready.com. And if you download the flyer from the handout, you'll get a discount code to use on our website. When you go to the National Registry, you're going to walk out of there and you're going to be scratching your head. I don't know a lot of people that ever said, well, gee, that was easy, or I knew all the words, or all those questions made sense. That doesn't happen. It really doesn't. Back when Bill Brown, the former executive director of the National Registry of EMTs, retired, I went to him and said, Bill, we're doing these apps. I want to do some really good apps. I want people who know how to write these questions. So Bill Brown from the NREMT, wrote these questions. We also have a former exam coordinator that goes through and reviews questions, both who have worked at the NREMT. I feel very confident we've got the best questions out there. Do you know how I know? They're going to make you crazy and scratch your head, just like the National Registry. There's times we get emails from students. Oh, gee, this doesn't match my book, or this is what my instructor said. Well, the National Registry isn't going to either. Doesn't matter what book you use. It doesn't matter what your instructor said. Doesn't matter what your protocols say. You need to not only have the knowledge, like I talked about earlier, but I want you to have the experience taking these questions, so you get to the National Registry and you're going to feel like you've already had questions like that before. It's going to help keep your head clearer. I mean, it really is. I joke around. I've been teaching for a long time. Right now in East Texas, I'm teaching at Galveston College. I'm doing an EMT and an AEMT class, and we've had probably a lot of the same challenges that you've had. You couldn't go into school, and some of the skills and clinicals have been canceled. I mean, things are really crazy. Then they closed the Pearson View Centers. I mean, you're a student in a time like no other time in EMS. I mean, really, the challenges, that you've had in front of you. But these questions are going to get you into a position where you're confident and you are ready to take the test. You will know what those questions look like before you go in, and you'll do them. Bill, I always joke, writes questions. I always say they're somewhere between amazing and evil. Some of those questions you're going to look at, even me as an educator, and somebody writes a textbook, looks at those questions. And I don't take these tests and get 100. You're not going to either. Nobody gets 100 on the National Registry. They give you harder questions until you get one wrong, right? So lean into it, use good questions, and we're going to go on. It's time for us really to get into some questions here. I'm just kind of looking through at the some of the questions that that people are putting in here. I'll just say really really quickly, I can't really compare myself to other things. I'm not going to say anything bad about any of the things a couple people have asked about specific apps. I think we have the best stuff out there. I mean, so I can say that. Everyone who's written our exam questions has written for the National Registry. They've gone to Columbus, Ohio, usually more than once. They've sat in that room, they've contributed questions, they've seen the process. So we give you really good questions. We're a 10-year-old company. Our technology is really good as well. And, you know, I think that's good. Another question, our apps are updated. These have everything that you will see on the National Registry. They have even concentrating on things that are new, spinal motion restriction, opioids, and naloxone administration. And the updates that the American Heart Association has released periodically since the 2015 guidelines came out are all in there. These are updated all the time. Matter of fact, when you log in, it checks the server, so we can update these on the fly. You don't need a new version to be able to make this happen. Let me get into some questions here, and I'm going to stop and look at these again. Drina asked, how long is the subscription last for the apps? There's no expiration date. These apps last forever and they stay up to date. And I think that's good. Another question, would I recommend the workbooks that came with the textbooks? And I think, workbooks are really designed to make sure you have the knowledge that goes with class. The workbook really kind of supports the textbook. And I think while it would be good to see you have the knowledge, I'm not sure the workbook is really designed to help you pass the National Registry. So let's pop a question up here. And I know that's what you're here for, and that's what I want to do. So let's look at this first question. Now, this first question, I have 5 questions, and I picked a different theme for each question. The first is pathophysiology. Now, I don't know how well your instructor taught you pathophysiology, but it's really important. Pathophysiology is the difference between memorizing and understanding. I am pretty fanatical about pathophysiology. My students, some of which are here, know that I really push it. And the pathophysiology that's really important really is about ventilation and respiration and perfusion. And those things just affect everything that we do. Not only our ventilation and breathing in the airway chapter, but anaphylaxis and shock, trauma and shock, heart failure. Everything has to do with pathophysiology. So we're going to put some questions up here. I'm going to put the first one up here. Now what I'm going to do is I'm going to put the question up, and I'm just going to be quiet for a little bit so you can read it. Not too long. I don't want you to sit around and wonder what's happening, but I want you to read it. I don't want my voice to give you any tips into what's important in the question. And what did we talk about? Read the question. Very important to read the question. The National Registry gives you a minute per question. Regardless of what exam you're in, you get a minute per question. The average length of time a person takes to answer a National Registry question is 31 seconds. So some questions are going to come up, you're going to look at it and say, okay, I think I got the answer. You're going to click it, you're going to submit it, you're going to go on, right? So you've built up some time. Don't create artificial pressure on yourself to rush through the test and make mistakes and miss things. Read the question. Sometimes I recommend reading it twice when there's a lot of stuff. and then look at the choices. And you may look at the choices and have to go back to the question, and we'll see how that goes. Here's your first one. All right, so an unresponsive 21-year-old male was shot in the left upper abdominal quadrant. His skin is pale and diaphoretic. You auscultate clear lung sounds, and his neck veins are flat. His vital signs: pulse of 116, respiratory rate of 120, blood pressure 100/72, saturation is 92% on room air. What type of shock should you suspect? So this is a pathophysiology question, and I don't think it's a particularly difficult pathophysiology question. But I like to talk about the 4 functional descriptions of shock, and you see those there: obstructive, cardiogenic, hemorrhagic, and distributive. All right, this gives me a chance to teach a little bit on these. Obstructive shock you might see in a tension pneumothorax or pulmonary embolus. Cardiogenic shock is generally an MI and heart failure. Hemorrhagic is from bleeding, sometimes called hypovolemic, because there's other ways you can lose fluid besides hemorrhage. And then finally, there's distributive. And distributive is when we have essentially the same amount of fluid, but the body doesn't distribute it well. And we see that problem occurring in anaphylaxis and sepsis. But there's reasons that we see things in this question that we can use to rule them out. Because what's interesting is that the chest and the abdomen are separated by the diaphragm. But remember, the diaphragm moves a lot, and that's what helps us breathe. It makes our chest cavity larger and causes air to rush in. And the diaphragm, when you exhale, comes way up under the ribs. So, you know, in a shot like this, the diaphragm is, you don't really know if you have a chest or an abdominal injury. And we certainly have vascular things in that upper left abdominal quadrant, like the spleen. So pale and diaphoretic skin to me says that it's probably not distributive shock. Right now, with a pale and diaphoretic skin is because the blood vessels have contracted. We've increased vascular tone in our extremities. As a result of that, that increased vascular tone, our skin gets pale and it gets moist. The temperature changes. You know, the blood coming to our skin helps keep it warm. So that cool, moist skin is because our blood vessels have constricted. And in distributive, that doesn't necessarily happen. We have a problem with our blood vessels opening up. So now we have 3 types here. Now, the neck veins are flat and there's clear lung sounds. So it says to me that's not like a tamponade or any type of problem with the chest or anything like that. The reasons our neck veins can be distended, also called JVD, jugular venous distension, is because blood from the head has trouble getting back into the chest cavity because of pressure. Is that obstruction, right? But these neck veins are flat. So we're going to rule out obstructive shock in this. And that brings us down to cardiogenic and hemorrhagic. And quite frankly, you have a person who was shot in the upper left abdominal quadrant, probably not his heart, and that leaves us with hemorrhagic. Now, I don't look at this question as particularly difficult. We started at a relatively easy level here, and we will get more challenging questions as we go on. If the National Registry puts something in a question, it's generally there for a reason. There's not a lot of fluff in these questions. Right? They're not going to be like your classroom tests. They're not going to be like some of the other ones you see online. It was a dark and stormy night. You and your partner were having dinner. You had the beef stroganoff. Your partner had chicken parm. When the tones went off, right? No, it's nothing like that. 3 sentences, a set of vital signs, boom. and that's what you got. They only give you just enough to make the decision that you need to do. All right.